Many older Coloradans say it's been a real challenge just signing up to get a vaccine. Now, the state is taking steps to make that easier, but some people are finding income and language barriers are making things even more complicated. CBS 4's Alan Janae on the story. Alan, there are additional hurdles facing people in some communities.
A lot of things to think about, Jim. You know, getting vaccines to communities like the one around this clinic on South Federal Boulevard in Denver has proved a challenge experts are still trying to figure out. So we wanted to talk with people working on it. We went to a clinic in hard-hit Weld County for a look. Case manager Ernesto Castro is on the phone checking on a woman who got sick.
She said that she's feeling better compared to her appointment.
In the lobby at Sunrise Community Health in Evans, just outside of Greeley, 72-year-old Nomi Torres Herrera waits. Do you know how to get the vaccine?
No, accident.
No, porque I have a whole clinic here.
Castro himself is a COVID survivor.
There's education, there's communication, and there is a language barrier that we need to break.
Dr. Mark Wallace heads the clinic. He understands why big health systems got the vaccine first.
I think it's easy to see. You get to your known partners that can respond quickly, and then you've got to be certain that you broaden out that community, bring more community assets to bear.
Into communities where frontline workers faced greater risks of exposure.
Did I feel valued by the government when I was working and coming down with COVID? And if I wasn't feeling valued then, why should I feel like I'm going to be included in any of this?
He says it'll take good communication on the right channels, noting younger family members often bring the information home.
Getting it into the youth, running it up the chain to the senior members of the family, and then sort of coming back down through that.
Like the talk Ernesto had with his own parents.
They said, hey, what are your thoughts on it? I said, Dad, Mom, after everything we went through, let's look into this.
Other things to think about, says Dr. Wallace, is are these vaccine clinics and sites open at times when working people can reach them? Many of them can't take time off. And he thinks there is another group that should be added to early vaccines, those living in multi-generational households where COVID often runs rampant. In Denver, I'm Alan Janae, covering Colorado First.